So what's the future? In last few decades, regenerative medicine has shown very promising results in treating these conditions. We've already heard about it. So certain advantages of regenerative medicine, in short, it enhances activity, improves range of movement, follows natural healing process, daycare surgery, shorter recovery time, so on and so forth. These are the commonly used orthobiologics in regenerative medicine. So let's focus on autologous conditioned serum. So what is ACS? It is a blood-derived product prepared by incubation of whole blood with medical grade glass beads, which results in a serum that is enriched in anti-inflammatory cytokines and high concentration of growth factors. So ACS was first used in the mid-90s for patients of osteoarthritis knee. It was used by Wheeling by the name of Orthopen. So let's have a look at how ACS is prepared. Firstly, blood is withdrawn from the patient around 30 to 40 ml. It is incubated in test tubes which are lined with medical grade glass beads. So what is the basic difference between Goldic and ACS as to why Goldic is superior to ACS? Goldic has high concentration of a molecule or a protein, that is gelsolin. So as you can see here, gelsolin acts almost on each and every organ system. It plays an important role in remodeling of cytoskeleton structure. It helps in bone remodeling, protection of neuronal cells, inhibition of apoptosis, so on and so forth. Goldic is also rich in components like hematopoietic stem cell growth factor and GCSF. So as a result of which, Goldic has more applications and a better immunomodulative potential. So now let's compare Goldic or ACS with PRP, which is the most commonly used orthobiologic. So firstly, I would like to say ACS is not PRP. So let's look at certain advantages and disadvantages of each. ACS is acellular, PRP is cellular. That is why we have more post-inflammatory reactions, flare-ups in injections of PRP. Chances of infection are also more with PRP. Processing of ACS is uniform. Like PRP, it is not uniform. We heard Dr. Meenal say that there is no standardized protocol for processing of PRP. Injection regimens are not fixed with PRP, where ACS has fixed regimens of injections, like generally 4 injections at interval of 4 to 6 days. So as a result of uniform processing, fixed injection protocols, results with ACS are uniform and they are longer lasting, whereas with PRP the results are not variable. Also, PRP is indirectly activated platelets which result in the release of growth factors, whereas in ACS we are directly injecting the enriched serum at the site of pathology. The advantage of PRP is that it is quick to prepare, while preparation of ACS is time consuming. Now let's have a look at what the evidence says about ACS. So these are studies of patients with osteoarthritis knee in which ACS was injected intraarticularly and it was compared with other factors like PRP, hyaluronic acid and even steroids. Outcomes were measured in terms of OMAC score, KOOS score and VAS score also in certain patients. So it was found that ACS is definitely better than other counterparts in terms of having better pain relief and longer duration of pain relief as well. These are a few studies where ACS was compared with steroids, namely triamcinolone, methylprednisolone, for patients of lumbar and cervical radiculopathies. And again, it was found that ACS gives longer duration of pain relief as compared to steroids. Here is an interesting narrative review about autologous conditioned serum applications in musculoskeletal diseases. So major databases were searched here for topics related to ACS and 21 papers were reviewed. And all of these papers had level of evidence 1 or 2. And they found that autologous conditioned serum in osteoarthritis has high quality evidence suggesting its safety and efficacy. But when it comes to tendinopathies, radiculopathies, despite of positive results, more evaluations and studies on these topics are recommended. Coming to this study, where it was a 5-year retrospective study where PRP was compared with ACS for patients of osteoarthritis knee. And it was found that when the scores at 24th month were examined, the superiority in both VAS score as well as KOS scores of ACS treatment group compared to PRP treatment group was found to be statistically significant. When efficacy and superiority of long-term ACS and PRP treatments were examined, ACS treatment was more effective than PRP treatment in the first 2 years. So these are certain studies where Goldic was used for lumbar canal stenosis and compared with steroids. Goldic definitely had longer duration of results. Goldic was also seen in patients, 4 years follow-up was done in patients where it was injected intraarticularly, and all of the patients were doing well till the time of follow-up. So what are the learnings from today's talk? I'll just take 1 minute. ACS an injectable solution enriched in endogenous cytokines. ACS leads to enhanced tissue regeneration and decreased tissue degradation. No serious complications, but still, apart from osteoarthritis knee, for other indications, large and high quality randomized trials with long-term follow-ups are needed. So I hope with the harness of knowledge and support of evidence, all of us are ready to jump into and explore this world of ACS. Thank you.